Getty stock millions of pensioners expect to have to sell or remortgage their homes to pay social care costs. An annual £15,000 shortfall between their expectation of the cost of care and the reality could force more than two-thirds of the UK's over 65s use housing equity to plug the gap. With total care bills exceeding £260,000 for some elderly people, the value of the typical three-bedroom semi-experts warn that even selling up will not cover all costs. UK pensioners anticipate paying £15,756 a year towards any care they require, according to the study by retirement house builder McCarthy Stone. These expectations are in stark contrast with the actual cost of care of £31,200 a year, rising to over £43,700 if nursing care is necessary. Wednesday, September 20, 2017. How much should I put in my pension? Social care remains hugely underfunded and people are not financially prepared for the potential cost of care during retirement. Clive Fenton McCarthy Stone, chief executive. This leaves a shortfall of almost 50%, a difference of over £15,444 per year, between the actual cost of care and pensioners' expectations, rising to 64% or £27,944 among those who require nursing care. The ONS estimates that the expected number of years people live with a disability is 8.4 years for men, and 10.3 for women. If help was required for the duration of this period, it would result in very large bills. Using the figure of £31,200 provided by healthcare consultancy Long Buisan, the total cost of care for men would equal £262,080 and £321,360 for women, notably more than the average UK house price of £225,956. Getty stock. Some elderly people have total care bills exceeding £260,000. As many as 69% will rely on any housing wealth to pay, despite 58% of those aged 65 plus believing this to be unfair. Clive Fenton, chief executive at the developers, said, "More people are living longer with multiple conditions, so the need for social care will increase rapidly. Despite this, social care remains hugely underfunded and people are not financially prepared for the potential cost of care during retirement, often leading to serious underestimations. The reality remains that more and more people will have to use their housing wealth to pay for their future care. Unless serious consideration is given to the issue, this challenge needs to be addressed head-on, and a wide range of solutions should be considered to avoid a social care collapse. We are calling on the government to implement a health and social care credit that discharges affordable housing obligations for retirement house builders, and as well as concerns about funding care, there are also worries about the quality of care they will be paying for. Two-thirds believe the UK's costsAN care system is insufficiently funded, and 63% say not enough is being done to provide access to social care at home for the elderly. Getty stock. As many as 69% will rely on any housing wealth to pay social care bills. The Retirement Confidence Index also recorded a drop in the overall confidence score to 6.4 out of 10 from 6.5 in 2016. While pensioners are fairly optimistic about retirement life, housing, companionship and finance, their fears about health persist. Almost 2 in 5, 38%, say their health is now worse than when they retired, and their concerns about the current state of social care weigh down their levels of optimism. Less than a fifth of over 65s have a good opinion of social care. 67% say it is insufficiently funded, highlighting the need for drastic action. In addition, almost two-thirds, 63%, believe that not enough is being done to provide access to social care for the elderly. Jane Townsend, of care provider Somerset Care, added, "We need a long-term, sustainable solution with housing at its heart that will help the UK overcome challenges, such as an aging population, increasing strain on limited social care and health resources, and funding shortage." The study also found that by downsizing to a retirement home, the average pensioner frees up almost £80,000 of equity.